Hello, everyone. My name is Nicole, and hello, Professor. I will be doing my video presentation on personal assessment and employee decisions. Just get it up for you. Okay. So, basically, in this presentation, as a short introduction, we're going to be doing an overview of the topic, importance and application to society, and some historical information. We're going to do identity and discuss psychometric properties of the most frequently used assessment instruments, and also discuss ethical, cultural, and societal issues concerning the use of psychological tests and assessments related to my topic. So, a quick overview. Personality assessments can be a strong predictor of job performance. They also demonstrate less potential for adverse impact than compared to cognitive ability tests. It's not surprising that the use of personality assessments for personal selection is becoming increasingly popular among organizations. About 75% of organizations are currently using personality assessments for specific selection or development in the business. And validated personality assessments are attractive assessment tools because they provide database, non-subjective method for identifying high potential employees who will all fit well into the particular work environment. So the importance and application to society, unlike other assessments, personality assessments demonstrates little to no adverse impact. They do not discriminate against certain members. Personality assessments can be implemented into the selection process as a way to increase the validity and reduce the potential for adverse impact. They're also linked to help determine who is more likely to be a successful performer. They help determine who will enjoy a job because people find the ability to express their personality in a job that they enjoy, which means they have to also enjoy their work environment. And personality assessments can help ensure success by identifying the right individual for each work environment. So what are employee decisions? They are choices made by employees about their employment and how they perform at a job. So specific examples would be hiring, promotions, transfers, separations, salary and benefits, and working hours. All of those are examples of different employee decisions within a job. So the history of personal assessments is the objective personality testing began with Woodward's personal data sheet in 1917. The test was developed to identify soldiers who were prone to nervous breakdowns in World War I. Soon after, many competing personality tests were developed for the use in this industry because they have so many different mental diagnoses starting from the war. So this was all the way back in this type of history time frame. Many of these tests, like Woodward's, focused on the construct of employee maladjustment and were deemed important in screening to determine any workplace disturbances that they were having. The origins of personality was from the military needs of 1910 to 1930. And like I said, it was with the Woodward's personal data sheet in 1919, starting at World War I. And the history and the nature of the questions and personality assessments focused to identify maladjustments and psychotism, which is a personality type defined by aggressive and hostile behavior, which is what, unfortunately, they can get like a PTSD diagnosis, which can have that aggressive, hostile behavior. And they also expanded upon the dimensions of the job performance, measuring constructs like leadership effectiveness and interpersonal skills. So for validity and reliability, it has been noted that the validity of personality traits, are rarely above about 0.30 for individual traits that tend to underestimate by meta-analysis that fail to match personality traits. The use of personality assessments for personal selections come with many problematic issues. Although I have seen throughout my degree of psychology, assessments have pros and cons. So for these problematic issues, it could be the appropriateness of linear selection models, the personality relation to self-selection. There could be multi-dimensional of personalities, the scores, things like that a lot of assessments unfortunately have issues with. Some of these issues have already been studied. It was stated that it is not an easy task for the candidate. There could be there might not be an agreement for what they considered as a good or a bad response, but the legal implication issue seems to be a more significant problem due to many applicants with the number of claims and disappointments. So the threats to validity of any psychological measure of a self-report nature is to understand the test and the principles of the test construction, why it's given, why that's being given out. In fact, interpreting the test results without such knowledge would violate the ethics code. They have to be trained professionals and know what they're testing. So the SSA requires that psychological testing be individually administered by a qualified specialist, like I said, so they're able to determine the score and interpret psychological training and then how to perform the test. Most doctorate level clinical psychologists have been trained in these types of tests in order to have the interpretation correct. It also requires individuals who administer more specific cognitive or neuropsychological evals, so they have the experience. And also neuropsychologists, they're individuals who have been specifically trained to interpret test results in a framework of brain behavior relationships in order to have a more required education and training to interpret tests of the cognitive nature. So all of these reasons will increase the validity and the reliability of these assessments. So these will be different assessment instruments that I'll be getting into in the next couple of slides. Like I said, the list to the left is going to be what I will be going over. And the use of these tests is not limited only to recruitment. They're also practical tools for monitoring employees, identifying any difficulties to advance the employees to have greater responsibilities. The first one is the 16 personality factors, or the 16PF. It's a questionnaire results from years of factor analytics studies. It was created by Raymond Cattell in 1949. It had 4 major revisions since then. It contains about 185 items. They're all multiple choice with 3-point answers. Each item is a question that asks about daily behavior, interests, and opinions. And it's an assessment tool that aims to provide a complete picture of the whole personality and 16 traits. So this is a table of what they're going to be assessing. Each test that I describe, I put a little table as to what the test will look like. So these are all different emotions that the test covers, and a definition and how the person will answer on the 3-answer scale of how they're feeling. Next is the Eysenck Personality Questionnaire. It was by Cattell, and Eysenck stated in 1985 that only 2 factors were necessary to explain individual differences in personality, with the argument of similarities between the proposed 16 traits. There was a 3rd factor added in that deals with predisposition to be psychotic or sociopathic. The developed model was known as the Eysenck Personality Questionnaire, or the PEN model. And the choice of the 3 factors limitation seems to be the lack of the greater importance attributed to the linguistic hypothesis, stating that most of the aspects of human personality are recorded in the substance of language. I do apologize about the layout of how my slides are. It looks like the sentences are not fully in line. I'm not 100% sure what happened to the layout there, so I do apologize. So for the table for this, there's the psychotism versus normality, which are the higher levels are more likely a sign of engaging in irresponsible or miscalculated behavior. Then extroversion and introversion, or the high levels, are a sign of more engagement in social activities. And neuroticism and emotional stability, higher levels mean a worry about relatively insignificant matters and you're feeling more stressed. So that's kind of have a scale of how they score those types of answers. Next, we have the 5-factor model. The 5-factor model was proposed by Tupis and Crystal in 1961 when they reanalyzed various data sets using bipolar variables constructed by Cattell in 1957. Traditionally, it was numbered and labeled as extroversion, agreeableness, conscientiousness, neuroticism, and openness. And then the Big 5 inventory contains 44 items with a scale of 1 to 5 choices, with the repartition of 8 to 10 items per factor. Again, I do apologize for the layout if it continues that way. So the table, we have openness, which is open people are intellectually curious, appreciate art, more sensitive to beauty. This factor is also called the intellect factor. We have conscientiousness, which is how people tend to control, regulate, and direct their impulses. They could be fun and easy to deal with. The extroversion is when they tend to enjoy being with others. This factor marks the pronounced engagement with the external world because they like being with people on the outside. Agreeableness is they value getting along with others and tend to be friendly, generous, and helpful. They believe in honesty and trustworthiness of human nature. I feel like I tend to be more of that level, in that factor model. And then there's neuroticism, which marks mental distress. This factor refers to the tendency to experience anxiety, anger, depression, or any negative feelings. Next one is the Myers-Briggs Type Indicator. It is most widely used indicator globally and thousands of tests performed every day. Most of them are in the United States. It determines the psychological type of highlighting a person, orientation, way of action, and thoughts. There are 6 forms. It's comprised between 93 and 290 questions where the candidate has to choose between the 2 alternatives. And the test identifies 16 personality types based on 2 possible preferences on each of the 4 dimensions. So basically, the 4 different types are extroversion and introversion. An extrovert person can react immediately and objectively in the environment. On the contrary, an introvert reacts internally and subjectively in the environment. Hint the EX and the NN, the prefix of the word. Sensing and intuition is a person with a sensing ability, relies on his perception and tends to be oriented towards reality. And then an intuitive person relies more on his non-objective perceptual process. Thinking and feeling is the thinking preference indicates the ability to be logical and rational in making deductions and decisions, when the feeling represents the ability to make subjective decisions with emotional events. And lastly, judgment and perception. Judgment and perception are indicators of the ability to be rational and rational in an interaction with the environment. A judgmental person combines thoughts and feelings to make decisions, where a perceptive person uses senses and intuition. Now we're to the third point of our introduction, which is the ethical, cultural, and societal concerns. For ethical, there are 4 main points for ethical. First is informed consent, which is obtaining true informed consent from individuals undergoing any type of assessment. They have to be like legal evaluations, schools, military. Consent must be assumed or given. The test results could significantly impact decisions regarding sentencing, educational advancement, or employment. Vulnerable populations such as children, cognitive impaired individuals, or non-native speakers may also struggle to fully understand the technical language of consent forms. So it is very, very, very important that any type of test that is done has to have informed consent from any test taker. The psychologist or clinician cannot administer the test without informed consent. Then there's confidentiality and data privacy. Psychological test results are sensitive personal data, raising from significant privacy concerns. They ensure storage and protection of this information, and they could fully informed about how their data will be used. Next is test misuse. Psychological tests can be misused when inappropriately administered, misinterpreted, or applied to situations. Up to 30% of organizations admit to using tests without understanding their implications. This is why previously I explained it's so important for these psychologists and clinicians to be trained in order to administer these types of tests to to receive reliable information and to interpret the results. And then professional competence. This is basically, like we just said, the professionals that are administering, they have to know how to interpret, administer, and collect the data. So it has to be specific training involved, and they have to have a good background as well. For cultural concern, there's cultural bias and there's misinterpretation of results. Culture is always going to be a main thing when it comes to assessments, whether it's the culture of the person, of the test taker, and the culture that's provided in the assessment. So it influences how individuals express traits, potentially leading to misinterpretation of the personality test results. So Some might feel downplayed of their culture. Some might feel like it's not included. Some might feel like it's only designated towards one specific. So having different backgrounds and having research about the culture and incorporate it in the assessment is very important. And also the impact on diversity and conclusion. So cultural bias in psychological testing can hinder efforts to build a diverse workforce. Studies indicate that minority groups may score lower on standardized tests, not because of the lack of ability, but due to the cultural bias. They might not have a full understanding of what is happening in the assessment if their culture is not incorporated. And then we have the societal concern. There's discrimination and adverse impact. It can lead to decreased treatment or adverse impact in protected groups, such as certain races, national origins, genders, religions, and ages. There's stigmatism that can be used during psychological assessments. If the results are misinterpreted or misused, that can have a negative impact on the individual's mental health. And there's an impact on workforce diversity and innovation. Without addressing potential bias can lead to a less diverse workforce, hindering innovation and creativity. They prioritize fairness and inclusivity in assessments that tend to see improvements in diversity and employment satisfaction. So lastly, our key points, just kind of putting everything together from what we discussed. Personality assessments have become an increasingly popular tool in the employment selection process. They offer organizations a standardized method for evaluating interpersonal traits, work styles, and behavioral tendencies. These tools are used to improve hiring decisions, reduce turnover, and align candidates with organizational culture. Personality assessments can significantly enhance the hiring process when used thoughtfully. They provide insights into how candidates may behave on the job, support better team integration, and help reduce costly turnover. However, employees must ensure that the tools they use are scientifically valid, ethically deployed, and legally defensible. When combined with other assessment methods, personality testing can serve as a powerful component of evidence-based hiring. And that is it. These are my references. 10 scholarly sources for my references and information. And that is everything that I have for my PowerPoint on personality assessments and employment decisions. I hope you enjoyed. Thank you.